Hello, everyone, and welcome. My name is Dr. Lopes, and I am super excited that you are joining us on this journey to success. In about 30 days, you will be board certified. I want you to imagine that, close your eyes, and believe it. We are presenting here everything you need to know to be successful on your board certification. On this module, we'll be covering scientific foundations, a very important part for your upcoming board certification. There are 23 videos, small size, so that you can devote the most attention to each one of those videos in small segments. No more we need to be off work to attend a live class. No more we need to be in front of a live class for 3 hours. This is one small piece that will complement your journey on this path to board certified. So let's get started. Here we are. This is our roadmap. On our first training one, we'll be covering the cerebrum, specifically the lobes of the brain. All right. So, in regards to the cerebrum, right, it is the biggest part of the brain. It includes about 83% and oversees all actions throughout the brain. Think of it as the CEO. There, you also have something called the broad Broadsman area, which are 52 distinct areas, right? Each of the cerebrum is divided in two halves, the right and the left. The left control most functions on the right side. The right side controls most functions of the left side. Why is it important? Well, let's say, for example, that you had someone with a stroke and they no longer can write with the right hand. So you know this is the left cerebrum function, right? If they can't see on the left side, you know the right side has been affected. But let's this down to each of the lobes, which is the most important concept of this training. So we are talking about the frontal lobe, which is responsible for your critical thinking, your personality. Frontal lobe is personality. Personality is the frontal lobe. Decision making, anything that has to do judgment and insight, it is your frontal lobe. The parietal lobe is all about sensory and information, for instance, like touch and knowing where your body is in space. The temporal lobe involves the processing of auditory. Temporal is for auditory information and memory formation, especially your long term memories coming back to you. It's part of your temporal lobe. How about the occipital lobe? It's I see. Occipital is all about the vision information. It's your occipital lobe. Well, let's break them down in a little bit more detail. As I mentioned earlier, the cerebrum is the CEO of the brain. It pretty much oversees all the functions. The cerebrum oversees 83% of all activities, with a line dividing the half and the right hemisphere. And this line is called the central sulcus. So dividing the both hemispheres and the lobes. So let's now go in more detail about the four lobes. To begin with, the frontal lobe. Let's master the higher function, that's the cognitive function of this lobe. It is the largest and most developed lobe. It plays a vital role in advanced cognitive processes. For example, frontal lobe, it's all about putting a puzzle together. Without the frontal lobe, you would not be able to do that. Creating a detailed plan for future actions is also part of the frontal lobe. In summary, here, when we say the frontal lobe, we are pretty much involving the working memory, the reasoning, the planning, prioritizing, sequencing behavior, insight, flexibility, personality. Personality is for the frontal lobe and judgment. So don't forget about the personality. Frontal lobe, master of the higher cognitive function. It also where the expressive speech, you are able to expressively speech, it is part of the frontal lobe. Don't confuse that with receptive speech. Expressive is your as you are able to express your voice in the correct manner. People with broken aphasias have damage that primarily affects the frontal lobe of the brain. But remember, this is expressive. Okay, that's the broker area. Aphasias is associated with which brain region? Well, if you guess, the prefrontal cortex is associated with expressive aphasia, which is, the frontal lobe is also about communicating the complex medical information to colleague and patients effectively. This is an example of how the frontal lobe um, plays on a day-to-day activity. Frontal lobe is for personality. The frontal lobe is the critical part region of the brain that is involved with personality development and can influence various aspects of the individual's behaviors when damaged. Frontal lobe's issues, you would have social skills, lack of social skills. A tumor in this area can affect behavior problems. Let me give you a little bit of an example. Back in the days in the 1800s, there was a person that worked making the rails for the train. Well, this person got into an accident, and by a miracle of God, he was able to survive. However, he had a rod through his head on the frontal lobe. Guess what? This person was well mannered and behaved. However, after the damage in the frontal lobe, he went through personality change. Now he became disinhibited. When he was polite, now he became rude. When he was thinking about the sexual activity, it was all about on his head. Now he's expressing to the young ladies out there. Guess what? That did not work out well for him. He had personality changes and social skills was affected. Guess what? It was such of a horrific accident that he could only hold a job in the circus. And that is because his frontal lobe was affected. So, for example, relationships to dementia, right? Patients with dementias often exhibit changes in the frontal lobe functioning, leading to a alterations in their personality, emotional states, and intellectual capacity. For example, a patient that has the dementia may struggles with maintaining coherent conversations or making sound judgment due to frontal lobe impairment. How can you remember the frontal lobe functions? You could use an acronym here stated as Flipper JW. Flipper JW stands for flexibility, language, insight, planning, personality, prioritizing, expressive speech, reasoning, judgment, and your working memory. Now, say it yourself, write it down. Flipper JR. Memorize it. What are the functions of the frontal lobe? Do not forget about personality change, behaviors change, and all the others functions that we mentioned to include expressive speech. So here's a question: aphasia is associated with which brain regions of the brain? Well, as we know, expressive aphasia is involved with the prefrontal cortex. Again, functions of the frontal lobe: planning, problem solving, motivation, decision making, impulse control, social social behaviors, personality, memory, learning, rewards, and attention. Now, how about the temporal lobe? Let's talk about the temporal lobe. The temporal lobe, it's all about auditory areas. Hearing is the temporal lobe. Main function is process auditory information from both ears. Language. Before we said the frontal lobe was expressive speech. Now, the receptive speech is the temporal lobe. And the receptive speech has to do with the Wernicke's area. Okay? For the function here is to receptive speech and language comprehension. And being able to understand is part of your temporal lobe. Memory, okay? Especially the long term memory, being able to retrieve it, it's part of your temporal lobe. Okay. Emotions also plays a part of the temporal lobe. For example, engaging in joyful activities while watching a heartwarming move, right? So when it comes to the temporal lobe, think about auditory hallucinations. We mentioned earlier that hearing is for the temporal lobe. Auditory hallucination would be involved in the temporal lobe. For example, hearing sounds or voice that are not present in reality, right? And you can think of this as schizophrenia patients may hear non existent voices talking to them. Now, receptive aphasia is a difficulty in understanding spoken words or written language due to the brain damage, especially the temporal lobe. One way to memorize this is aphasia. All people have a serious issues with aphasia. So the temporal lobe, amnesia. Remember, we talked about memory, right? Amnesia is also the temporal lobe. For example, troubles forming new memories or recalling past events due to brain injury. Okay. So if a patient suffering from a memory loss after an accident, most likely this is because of the patient. Okay. Also, it could be due to a cerebrovascular accident. It also involved with your sleep wake cycle and being unresponsive, such as in common or lose of a conscience. Now, again, the receptive aphasia is the temporal lobe and has to do with the Wernicke's area, which is the inability to comprehend both spoken and written language, even when the speech is clear and present. Again, temporal lobe, hearing, understanding language, memory, and behaviors. Now, let's talk about the occipital. I see your vision, it's about occipital lobe in the back of your head. So, when we talk about the occipital lobe, it is all about the visual cortex, the hub of vision processing, reception, and analysis of visual information, coordinating with other sensory inputs for meaningful interpretation. In clinical applications, we could see that the problems associated with occipital lobe, for example, if one has a complete partial visual field defect, even though the eyes are normal, that could be due to the occipital lobe issue. Now, when it comes up to blindness, if the eyes are healthy, that could do would be due to the occipital lobe. Visual hallucination. If the temporal was for hearing problems, hearing hallucination, visual hallucination would be the occipital lobe. Okay. So don't forget that visual hallucinations associated with the occipital lobe. Now, if we ask you in regards to dimension, there's a type of dimension. I'll tell you in a second which one that has visual hallucination. Can you think of a dimension that has visual hallucination as their hallmark for the disease? Well, let's find out now. If you guess it, Lewy body is for visual hallucination. The hallmark of Lewy body is visual hallucination, and that is a problem with the occipital lobe. As I mentioned, all I see kind of reminds you of the picture of the brain from the back, the occipital associated with vision processing and in the mind. Let's take a look here. Occipital lobe the of the brain is located in the back of the mind, right? It's in the back of the cranium there. The primary function is processing of shapes, colors, emotions, integration, interpretation of vision and stimuli. Damage here can cause blindness, even if the eyes are healthy. Now, how about the parietal lobe? This is a very important lobe. Okay, so primarily it is responsible for the sensory area, responsible for processing sensory information from the body, feeling the warmth of a cup of coffee. That is part of your parietal lobe. When we say parietal lobe, think about taste, reading, and writing. Parietal lobe is for reading and writing. Okay. Involvement in the processing of taste sensations plays a role in cognitive process related to reading and writing. So if someone cannot write in a piece of paper, it has to do with the right parietal damage or right hemisphere damage. Okay. So clinical implications here. Think about the sensory perception disturbance resulting from problems in the parietal lobe, difficulty interpreting sensations accurately. Okay. An example given here is interpreting the sensations of wearing clothing as something crawling on the skins. Okay. So it also has to do with agnosia, right? Which means the inability to recognize or interpret sensory information such as visual or auditory stimuli, even though the sensory function itself is intact. So I am not saying that the visual hallucinations unable to interpret is the parietal lobe. I'm just saying the agnosia is inability to detect the stimuli coming from the environment to our brain, as compared to a stereognosis. A stereognosis is the abnormal in the parietal lobe, which is difficulty identifying object without a sight. For example, if I close my eyes and get this mouse in my hand, I can tell that it is a mouse. If I have a problem identifying this object without seeing, would be a stereognosis. Let's take a quick look again. The vital roles for parietal lobe has to do with the sensory perception and integration of the sight, taste, hearing, smell, and touch. Parietal lobe is responsible for writing, speech, and even cognition. Don't forget writing. Damage here has to do with the damage of the parietal lobe. Now, let's do a check on learning. The symptoms of memory difficulties, planning, challenges, prioritizing issues, lack of insight, and impulse control problems in the patients are likely caused by dysfunction in which part of the brain? A. Temporal lobe. B. Parietal lobe. C. Frontal lobe. Or D. Occipital lobe. If you guess the frontal lobe, you got these questions correct. Okay. So patients experience issues with memory, planning, prioritization, insight, or impulse control. Personality is likely due to a damage in the frontal lobe. The temporal lobe is primarily responsible for processing auditory information and language comprehension. The parietal lobe is involved with spatial awareness, knowing where your body is in space, coordination, and reading and writing. Parietal lobe. And the occipital lobe, primarily concerned with visual processing. That's it, guys. We just finished module one, training one. I'll see you on our next training. of this module. Bye bye.